Hello friends, welcome to this important topic on Budh-Chiari syndrome. So in the module on cirrhosis of liver, I have taught you about the different causes of portal hypertension. In that causes of portal hypertension, what I told you, post-hepatic cause of portal hypertension is one of the Budh-Chiari syndrome. I could have included this Budh-Chiari syndrome in that module of cirrhosis, but that would have unnecessarily prolonged the lecture. But since Budh-Chiari syndrome, they ask you 2 to 3 questions, so I have kept it as a separate module, which will be a small module, but it would be better for you guys. Okay. So coming to what is Budh-Chiari syndrome. So Budh-Chiari syndrome is basically a post-hepatic cause of portal hypertension. It is a post-hepatic cause of portal hypertension, and it is defined when there is a thrombosis. When there is a thrombosis of 2 or more hepatic veins. And there is a thrombosis of 2 or more hepatic veins, right? So this is a very important part that you need to remember, that in Budh-Chiari syndrome, there is a thrombosis of 2 or more hepatic veins. Ultimately, that thrombosis might go into IVC. But what is important take-home message is there is a thrombosis of 2 or more hepatic veins. And the most common cause of Budh-Chiari syndrome worldwide is myeloproliferative disorders. But in India, most common cause of Budh-Chiari syndrome in India is IVC webs in the IVC, that is the membranous obstruction of the inferior vena cava, is the most common cause of Budh-Chiari syndrome in India. Now there are various subtypes of Budh-Chiari syndrome. What are those subtypes? You can have a acute fulminant presentation with liver failure. What will have in those acute fulminant presentation? You're gonna have abdominal pain, ascites, there will be deranged LFT, the INR would be increased, and there will be presence of hepatic encephalopathy. So if there is a acute fulminant presentation with liver failure, then only choice of treatment is liver transplantation. Now, if you have a acute fulminant presentation, it would be, all the features would be same. The features would be same except for presence of liver failure. The chronic would present like cirrhosis. The chronic subtype would present like cirrhosis, and the most dangerous type is subacute because it would have a minimal ascites. It's gonna have a minimal ascites with minimal hepatic necrosis. So to say that patient is mostly asymptomatic, what we can say that the subacute Budh-Chiari, the patient is mostly asymptomatic. So it might be diagnosed if the patient has got some other complaint, maybe a recurrent pain in abdomen or something like that, and the doctor is doing an ultrasound and the radiologist is sound enough to get some finding that he goes for a Doppler. Then only the subacute people can be diagnosed. Otherwise, this is a very difficult case to be diagnosed when the Budh-Chiari syndrome is in its subacute presentation. So what are the clinical features? The patient comes with right upper quadrant abdominal pain. So it can be confused whether you are having an acute pancreatitis or acute cholecystitis. Then there would be presence of ascites. So right upper quadrant pain with ascites. Along with that, you can have presence of portal hypertension. So if there is a portal hypertension, there would be bleeding varices. And you're going to have tender hepatomegaly. Now,